Okay, Assalamu alaikum. Welcome everyone on board. Um, we the purpose of this today's brief session will be introducing the specialty of neurosurgery to medical students, to junior doctors, or anyone who just want to have just introduction what neurosurgery is, what are the pros and cons, what are the challenges, what are the prospects. Okay, over to Dr. Adil, who is working as a neurosurgeon in King Faisal Specialist Hospital and Research Center in Jeddah, Saudi Arabia. Over to Dr. Adil.
Yes. Assalamu alaikum. Thank you very much. Thank you for the kind information. Actually, I'm working as an assistant consultant neurosurgeon. It was written as a consultant in the message, but I'm working as an assistant consultant neurosurgeon in King Faisal Specialist Hospital in Jeddah. For the past 5 years, I completed my graduation from Hamdard University Hospital, Karachi. And after my graduation, I pursued for FCPS and Alhamdulillah cleared my FCPS in the first attempt in 2011. After that, I started my training in GS in Mio Hospital, and then later on, I did my neurosurgery in Jinnah Hospital, Lahore. Now, the question mostly arises that why did I choose neurosurgery? Actually, so there are certain many factors that affect why a person choose one field. In my case, I had a neighbor who was a neurosurgeon here in Jeddah who used to work as an assistant consultant in the same hospital at the same position where I am working right now. This was almost 23 years ago. I met him, I was inspired by him. At that time, I was in FSC pre medical, and I was very much inspired by him, and I chose to like follow his footsteps and become a neurosurgeon. And I take guidance from him even till this date, till today. I'm in contact with him, often take his guidance in certain issues and to enhance my learning and things like this. Now, neurosurgery is a field that when you ask many of the neurosurgeons that why neurosurgery, you will have a spectrum of answers. Someone will say that it is a unique field. Some people will say that they are like fascinated by the functioning of the brain and things like this. But if we focus that why many people say that not neurosurgery, why not neurosurgery, there are certain myths about neurosurgery. If we talk regarding in our population, that many people say that outcomes are not that good. I would, after working for almost 6 years post fellowship and 6 years during training, I would say that that is not the case. If the selection criteria of the patient is good and post operative management is good, the outcome is also good. Okay. What happens that what is one thing is said that when you are a surgeon, one of my teachers said that you are a surgeon when you know when not to operate and where not to operate. That when to operate, almost everyone knows, and where to operate, anyone can operate in any circumstances. But where not to operate, which cases this is, and when not to operate, which cases this is when you're a real surgeon. In many cases, in Pakistan especially, when we see that there is a high mortality, if we go do a root cause analysis, we would come to know that the post-operative care is very lacking. That is not because the neurosurgery is not up to date or the neurosurgeon is not skilled enough. The issue is other factors of the hospital, such as the ICU is not fully equipped, or the nursing staff is not fully trained, or the post-operative care doctor, the physician that was supposed to inform the regarding the possible complication was not well trained in order to manage these things. Second thing is when we see in the government sector, the main bulk is for the trauma patients, and most of the trauma patients are presented to the hospital as a delayed case. and that also contributes to the high mortalities that normally people in Pakistan see. Well, while choosing a career, one should not focus on one person or one place. He should see the career in a broader perspective as a whole community of doctors practicing a whole specialty in the whole world. Like you could not decide based on one hospital of Pakistan or one hospital of Saudi Arabia or one hospital of United States that okay, this field is to be chosen or this is not to be chosen. Maybe there are certain hospitals or certain doctors whose outcomes are very excellent in a specific place, but the other specialties or the other doctors do not have such an outcome, and in the same setting, that is we can say that there was an excellent neurosurgeon, but he did not have a good anesthetist or a good intensivist who could take care of that patient. The patient eventually had morbidity or mortality depending upon that specialty, and we blame the surgeon or we blame the intensivist that this thing had happened. So there are other reasons why people say that it is a lengthy field. I would say that other fields are equally lengthy. Like in Pakistan, the training is 5 years. That is, in my days, it was 2 year general surgery and 3 years of neurosurgery, in which there was a time of almost 9 months of rotations, which was too much rotations and too less neurosurgery. I've heard that they have upgraded something. The CPSP is doing has done this as a good job, that they have reduced the time of the rotations. I do not know exactly how many months rotation is right now going on, but the CPSP has reduced the time of the rotation and the time of neurosurgery has increased, which gives a good chance for the residents in order to train for neurosurgery, in order to train in their core specialty, which would benefit them further. Now, the equally lengthy specialties are like you can say cardiac surgery. In Pakistan, it is also 5 years. When we talk about the United States or Canada, these specialties are of 7 years, both of them, the neurosurgery as well as the cardiac surgery. Then it comes vascular surgery. In Pakistan, it is much lengthier than neurosurgery, that is 4 years of general surgery, followed by 2 years of or 1.5 year of vascular surgery. So all of these specialties, which are relatively, like you can say, as a high risk or uh, I would also say that a high reward, the
And Dr. Adil, sorry to
surgeries.
interrupt you. If you can bring your mic
Ji,
a little towards you because your voice has gone down a little bit. So,
sure, sure. That many of the many of the specialties that are like the surgical specialties are similarly have a similar period of time of training. Second thing is regarding that if one say that one cannot balance between family life as well as the career in order to maintain it. I have seen people uh, managing it very good. Even there are many female neurosurgeons nowadays, even in Pakistan. There are female neurosurgeons reaching up to the rank of the professor and who have got an excellent family life
well,
and they are managing the career as well. The thing is that once we see that in Pakistan, in specific setups, that there is a high load of trauma there. Of course, the quality of care varies. Also, the quality of life of the surgeon varies. Whenever a surgeon moves abroad, these things, depending upon the manpower, depending upon the what we are being paid, the overall economic conditions of the country, the life standards improve generally. So it will help also in career building. The other things that contribute in like neurosurgery, which are as a myth in Pakistan, that neurosurgeons, because this is high, you can say highly stressful field, so the dropout rate is high. Yes, I would agree on this thing. There is a very high dropout rate of the neurosurgeons, not just because of the stress, also because of the like many people do not find many people come here just because of charms and fascinations. They do not have an idea that it is wherever there is a paying field, it is also a highly demanding field. The surgeries are lengthy and tiring. If you focus good and do the surgery with your heart, I don't think that someone would regret coming here. It needs a lot of focus. A person who is good at focus and good at dedication, they do their job well and they're really happy and they enjoy the lifestyle of a neurosurgeon. Neurosurgery not always is emergency to emergency or life saving to life saving. Neurosurgery has evolved a lot with the time and is an evolving field. Like a few years ago, there were certain specialties now exist that were not existing on that time. Neurosurgery, what we see normally in Pakistan is either general neurosurgery or spinal neurosurgery. But whenever we move to other countries, there are certain fellowships that are being done, such as neuro-oncology surgery, functional neurosurgery that deals with the pain, that deals with the movement disorders, that deals with implantations, electrode implantations, and things like this. There is epilepsy neurosurgery that is being done in our hospital, in our center. Then comes there is skull-based surgery, neurovascular surgery, there is peripheral nerve surgery, and also there is neurotraumatology that is also being practiced as a separate field elsewhere. Uh, Wherever there is enough manpower, the working environment does not remain so toxic as hello. Yes, the wherever there is enough manpower, the working
स्मेल
environment
से
does not remain so toxic. So
तो
the things get
क्या
diluted
बोल
out, and the people enjoy working. Yes.
कर देता है मुल्क जाता है मुल्क
Dr. Adil, sorry, you are mute by mistake. You can unmute yourself.
Hello.
Yeah.
Yes. Hello.
Yes. And your voice is not, I don't know what has happened. You are sitting away from the mic, or what has
No,
something has happened. Your voice
I'm
is decreased.
okay. I'm sitting just beside the mic.
Oh,
I've
no.
turned off the
Now it's
camera just because of the mic.
now it's better. Now it's better. Now it's better.
Okay. Sure.
Okay,
Sure.
so
Sure.
few questions in the chat box. One of them was your journey from Pakistan to Saudi Arabia, and how is your work-life balance in Saudi Arabia, with reference
Mhm.
to how to
Sure.
be a neurosurgeon as an expatriate.
Is that in Saudi Arabia we say that we are accepted as a consultant here based on FCPS only. Okay, but the thing is that here they give us the rank of the consultant in only secondary care to tertiary care hospital for neurosurgery. For neurosurgery, I am working in a referral center where they do not accept as a consultant. So here I am working as an assistant consultant, which is equivalent to that of the registrar. Uh, how I moved to here, I actually, when I was in Pakistan, I was working in Jinnah Hospital, and there, the shuffle ups of the government that happen up. they transfer you from department to department, and during that time I was away from the neurosurgeon. Being a neurosurgeon, I was in posted in administration, which was very like frustrating for me. So I decided that I have to move out of the country, else I'm like this is not the field which I was supposed to do. I'm supposed to see the patients, not to see the departments. Then I applied online in various on various forums. Like I applied on the LinkedIn to different recruiters, and from the LinkedIn I contacted. I went to different hospitals IDs that certain hospitals, just like National Guard Hospital or Security Forces Hospital. When you go into that hospital's ID, you see many doctors working over there. Then I would search for the like browse through the doctors and see who's a neurosurgeon. I would send him my CV. I would contact him, send him a personal message that I'm searching for a job and things like this, and try to get in contact with them through like most of the people are kind enough that they reply you and they give you even their personal WhatsApp contact or their Facebook contact. Also, I applied on various um, these recruiting agencies, just like Al Najam, and there is Qurashi and American Exchange International. So the thing is that after like almost within 4 months of search, Alhamdulillah, I got uh, 6 offers, and one of the offer was from a place that there I did not even directly apply. They said that you gave your CV to this recruiter, and the recruiter forwarded his CV to us because he did not have the post for that. So this is the thing that these are the different ways how you could approach. So after reviewing all the 6 places where I was like from where I had the offers, I selected King Faisal Specialist Hospital, being it as one of the good hospitals with a good working environment, and also that I had someone working here with I had known someone working in this hospital. The person who I used to know had gone from this hospital long ago, like 10 years ago. He had went from back in 2014. He had left this hospital, but he told me that this is a good place to work, and the systems are good and things like this. He did not directly know anyone here. There was a senior colleague that I knew who used to work here, but he also himself said that if you come through through the recruiters channel, only then you can be like recruited. No personal CVs are accepted here. So this is so I got this job via a recruiter, and Alhamdulillah, I'm now working here for 5 years, and it was an excellent experience in terms of workplace environment, in terms of work and life balance. Here it is good, but everything comes for a cost. If I'm working as an assistant consultant, I'm basically doing the job of a registrar, for which I'm just preparing the patient, not getting any admissions on my name, and my surgical skills are directly not getting enhanced. Although I have got certain like uh, ways how I am trying to improve my skills, and I'm even doing surgeries, but not directly in the hospital.
Doctor,
Second
in
thing
which country you are? In which
Uh,
country you got?
I'm in Kingdom of Saudi Arabia. I'm in Jeddah and King
All right.
Faisal Specialist Hospital.
Oh, okay, right, doctor, right, right.
Okay.
Doctor, if you could help me, I don't know, it is the time to for asking questions or
No, no,
I'm
you
doing
can
an
ask questions.
interruption.
Yeah, yeah, you can ask questions.
I am searching for a job and I'm from Jordan. I'm Dr. Abid Al-Latif from Jordan. And
Yes,
I
nice to
have
meet you.
an interview from Saudi delegation who came to Jordan, but I
Mhm.
was not able to get the job number.
Hmm. Hmm.
And that is about 2 years back. Some people they saw my name inside the system of Ministry of Health in Saudi Arabia in Riyadh, and they are saying that there is we need a consultant plus female in ops and gynae. So I need some support, some help,
Uh,
some
Apologies.
recommendation.
I'm really, really, really sorry because actually the domain of today's discussion is beyond it. But you can just drop a message and we will try to. I will try to find out what we can do for it. Okay. Uh,
Yes.
sorry, I'm really
Okay.
sorry.
What's
Doctor
your name, doctor? What's your name?
Dr. Zishan Javed and Dr. Adil. You can just drop your. I will just give me a minute. I will drop my number in the chat box. A few things which I was
Okay,
just
okay, okay,
trying
doctor.
to highlight with reference to neurosurgery. Dr. Adil will like highlight it because as an anesthetist, we are always attached with the surgeons, variety of surgeon, which what we see from outside. Neurosurgery is a very like extremely sensitive surgery. The area of interest is very small but very narrow, and they are working on microscope for hours and hours and hours. So this is actually this is a problem for all surgeons. Like I did not become a surgeon because I cannot stay because of some of my like rheumatological problem. I cannot stand for or sit for a long time on that in one position. So
I see.
remember
I
one thing,
see.
neurosurgery is one of the speciality in which you have to be static and you have to be firm for very long hours. So this is one thing which I will highlight. The other thing, patient the specialities with which the neurosurgeons are totally directly involved. One of them is radiology, one of them, of course, is anesthesia, one of them is ICU. Another very important component which will improve the or change the outcome of neurosurgery is electrophysiology. Okay, because a number of surgeries they are doing the electrophysiological monitoring in which they are just taking care of the pathways, sensory and motor pathways, if they are working in a specific area which can damage. So they are doing a separate department is there which is doing the electrophysiological monitoring. Okay, and navigation is actually Dr. Adil, can you explain some words about navigation? Maybe I would not be
Yes,
very good. Yes.
navigation another marvel of the modern world, that it is just like the navigation of the car. It gives you the directions where to go, how to go, which is
Yes.
the safe route, which is the
How deep?
fastest route,
How
closest
deep?
route. Yes, how deep to go, where to go, and when to stop. This is
Yes.
very important thing. When to stop, that there is a vessel in front of you or there is a ventricle in front of you that you do not have to open in this case, so it will tell you to stop here. So some of the cases, not all the cases,
Uh,
are
uh,
being done
I'm sorry,
blindly.
just to make them, just to explain to them, not entering in a haram area. Okay, so navigation is the one they it will guide you where you have to stop, as Dr. Adil mentioned. Okay, yes, sir, please.
Yes, and the thing is that, as Dr. Zishan mentioned, it is a highly sensitive area. Like you have got vessels of a few millimeters, which are supplying a big area of the brain. And if some of the vessels get damaged, or they might bleed, or they might clot, or and cause a major infarct or a major hemorrhage. So the thing is that navigation helps a lot, but these tools, alhamdulillah, are available in Pakistan centers. And electrophysiology, yes, it makes a difference, but there are like controversial studies. Not every case they use the monitorings, not every case they use the navigation. In simple superficial cases, navigation is not required, but in deep cases, especially in cases which we are doing blindly, just like placing an electrode, or placing a shunt, or placing or taking a biopsy from a single burr hole. In those cases, navigation is quite helpful. So these things that Dr. Zishan has mentioned have improved the outcomes of the neurosurgery as well. Now, as all these things are quite costly, so you cannot see them in all the centers, but many big centers in Pakistan have these facilities. If not all, then at least a few, like navigation, electrophysiology is somewhat being monitored, and these things improve the outcomes and make the surgery relatively easy. Surgeries are lengthy, as I told you before. Yes, they are lengthy. You cannot stay inside in the surgical field until you are totally dedicated and motivated for that surgery. I remember on the first day when I joined neurosurgery, I was post call, and there was some, I think, tuberculous spine, and tuberculous spine is quite difficult spine. In Pakistan, we used to do a lot. Here, we do not use here, as the tuberculosis is less. We see less.
कब करी थी? Okay.
So the thing is that tuberculous spine. I was doing that case, so the case took like 9 hours or 10 hours. I was post call, and I was happy to do it because that was a field in which I was interested, and I wanted to do it since ever. And now I'm getting a chance to do it, so why not do it? So, but if you're not totally dedicated to it, motivated for it, such long surgeries, like you will not like it. So yes, we are very closely related with the MRI and with the radiology people. We normally, neurosurgeons normally prefer to read our images ourselves, the pre-op as well as post-op. We do not base our decisions mostly based on our decision on the report of the images. We study the images ourselves and then decide whether a surgery should be done or not. Yes, nowadays ORs are also equipped with intraoperative CTs and intraoperative MRIs that, in close collaboration with the navigation equipment, give us the real-time imaging, that how much tumor has been excised, or where exactly the electrode is placed, and things like this. In Pakistan, Alhamdulillah, intraoperative CT I have seen in two centers. I do not know whether an MRI has been purchased or not, but in Saudi Arabia there is intraoperative CTs as well as MRIs in many centers. So these all are costly gadgets, although they improve the overall mortality and overall outcomes. I would say that even prevent the morbidity, but are quite costly for it, for especially for a third world country, to maintain them in the longer run. Uh, yes, Dr. Zishan is giving me an excellent input regarding the ICP. And Alhamdulillah, in Pakistan, I used to work in a center that was equipped with ICP monitoring, and I have done a lot of work in the trauma settings as well as the ICU settings. The yes, ICP monitoring gives a real-time imaging of an unconscious, real-time measurements of an unconscious patient, that is his intracranial pressure rising, or is it stable enough? Do we need to do any intervention or any medication? ICP means intracranial pressure. It used to increase in settings of trauma, in settings of hemorrhage, in settings of brain edema, secondary to surgery or secondary to a tumor. So the thing is that we used to place an electrode. There are multiple types of electrodes. There are the brain parenchymal electrodes. There are interventricular electrodes. We used to place the interparenchymal electrodes and see the pressure as a digital reading. And that once the digital reading would cross 25, then we would, or 20, depending upon the time and the setting, that in certain patients at 20 and certain patient at 25, we would do an intervention, either a surgery or injection of mannitol and other ICP measuring methods. Yes, these all, yes, EEG is an excellent tool in Pakistan. And yeah, almost all the tertiary care hospitals have got this EEG, which is electroencephalogram, that reads out that there is an epileptical focus, and this thing is important in diagnosis of the seizures. And once the seizure has been diagnosed, then we can, if it is lateralized to one side and one part of the brain, that can be removed. And I have seen very miraculous, life-changing events in patient's life after the epilepsy surgery, especially in our setups. So EEG is a thing. Cerebral oximetry, I have like read about it, but I have never experienced it, so I cannot say anything regarding it. Um, Jugular venous bulb, again, these things, I think Dr. Zishan would be better to
Yes.
explain it
Um,
because we never, I haven't experienced these things.
okay.
What I have
Actually,
been
few
through,
of the words, few of the words. I'm sorry, Dr. Adil, you finish, then I will say few words, and then you will help me out for that. Yet, please finish what you were saying. I'm sorry to interrupt.
sure. I was saying that I could only explain the things or give my input on the things that I have experienced through my little experience, of course. And but the things that I have not experienced, of course, I would like to listen from you. If any discussion, any questions from the persons attending.
Yes, I will take few minutes, and please, any of the medical student or any of the student who want to pursue as a neurosurgeon, please feel free to ask any question. Doctor, you just think about this question in the chat. If you can just scroll through the chat box. In the meantime, I will
Yes,
say few words,
I have
and you
I
can
have
answer.
seen.
Yes,
Yeah,
you
sorry,
just.
I'm
I will take few minutes only. Actually, neurosurgery is a wonderful specialty. In last maybe 1 decade or so, neurosurgery has been totally changed, and totally you can say that the role the some people have intruded the neurosurgery the specialty. The one of them is interventional neuroradiology, because a number of procedures which actually neurosurgeon used to do a number of things being controlled, or maybe, like for example, I'll give you an example. There is a brain tumor. Now, through interventional neuroradiology, they will embolize or block the vessel which is feeding that tumor. So what will happen after some time, when the patient will be coming for the surgery, the outcome will be very good. Like you have squeezed the neck of the tumor, so that will increase the outcome, that will improve the outcome in the wonderful way. This is one point I wanted to tell. A number of like aneurysms which will actually lead to brain hemorrhage, they are being dealt in intervention neuroradiology. A number of problems leading to stroke or TIA or anything like that, they are being controlled by interventional neuroradiology. They are doing the coiling, they are doing embolization of the thing. So interventional neuroradiology has changed the outcome of neurosurgical or neurological outcome of the patients in a wonderful way. And if as a doctor, maybe a number of surgeons, they are actually very very sophisticated artists, or the general surgeons will kill me, but neurosurgery is one of the specialty in which they have to be very very good in neurophysiology and neuroanatomy. Because if they are not good, because maybe in general surgery that is not that much delicate. I'm not saying that they don't know the anatomy, but neuroanatomy, and especially in neurosurgeon, or I will also add cardiac surgeon, they are the one who have very good knowledge, or who have very good reflexes with reference to physiology and anatomy. Okay, so, and it's very sensitive because it will be a very small area which will be controlling the neuro the speech center, or motor system, or sensory system, or vital organs, vital areas, like in brainstem and things like that. So these are the things which are very important, and all of the theory, all of the story will be revolving around ICP. Okay, so even as an anesthetist, and even the surgeons, they will be taking care of anything which can change the ICP, and in especially in trauma, because in trauma, primary injury you cannot prevent, but whatever neurosurgeon is doing, or whatever neurosurgeon wants the anesthetist to do, or anything they are doing with the help of radiology or whatever, their aim is to prevent or minimize the secondary brain injury. Primary brain injury has occurred at the time of impact, and the secondary brain injury is will be occurring after that, because of reversible factors like oxygen, CO2, blood volume, ICP, cerebral perfusion pressure. Okay, so these are the things which are very very important, and whatever they are doing it for it. MRI and CT scan also improve the outcome, in the sense that sometimes they are doing MRI right after anesthetizing the patient in the same go, and then after surgery they are again repeating it. Have a look if they want to do something extra even before closing of the skull. They are doing it. Okay. So these are the few words which I just noted down. Yes, another very interesting thing is that usually bleeding in other specialties occur in a bulk. Okay, but neurosurgical bleeding, because it's occurring in a microscope very slowly, 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 but it is going on and on and on. So as an anesthetist, we have to be very careful about estimation of the bleeding. Even surgeons, they can miss sometimes because the surgical field which they are looking at is through microscope, and it's very narrow field. So it's sometimes it's
Yes.
very challenging thing for anesthetist to make sure how much bleeding has been occurred. And as Dr. Adil has already mentioned, neurosurgery needs a lot of persistence, a lot of hard work with reference to, because the learning curve is because anesthetist, any anesthetist who is going in the anesthesia OR, after 2 days he will be doing a number of procedures which even professor is doing, like endotracheal intubation, like spinal. But for neurosurgeon, you cannot imagine. Okay, so the learning curve is one of the most difficult for neurosurgery as compared to other surgical specialties because of the delicacy of the thing. Okay. So that's why it's very important to work in a very good setup. And as I will just add on and I will give back to Dr. Adil. Remember one thing, that a number of people who have done FCPS, they don't know what to do after that. A number of people, they are only thinking about FRCS, or they are only thinking about some European qualification. But I will just suggest all of you, whatever stage of your career you are, even this message is also for Dr. Adil, and that at any point of time, if you do USMLE, you can open yourself for a fellowship program, or just an experience. It doesn't necessarily mean that you want to immigrate to US. You can just have a cherry on the cake, to your experience at whatever stage of your career you are. You should try to have a fellowship in US of whatever subspecialty you are. This is not only for neurosurgery, this is for me, this is for any other doctor who is not able to get the match even, and later on after maybe 10 years he has got a very good experience of his specialty, his or her specialty, and now they want to add on. So they can always try for a fellowship program in US. Yes, it will be difficult, but they, at least in my opinion, we should try to have the best out of the best. Okay, so American training and American system, maybe I'm wrong, but maybe I'm a little biased about it, but I think the American system is the best in the world. So there is no match. And another thing, there are so many opportunities which people don't know. People don't try because they don't know about it at all. So that's very important message for all of you. We have given just an outlook, and in coming weeks I will be contacting a number of people. It's really kind of Dr. Adil to give us time to enlighten us about neurosurgery. Okay, Dr. Adil, back to you. If you want to
Yes.
answer some of the questions, or please, because maybe in 5 or 10 minutes we will finish. So any one of you
Sure.
have any question, you are welcome. I have put my number. You can contact me, and I can even I can facilitate to get the answers even later on. Okay. Yes, Dr. Adil.
Sure. Now there are certain questions that were asked, excellent questions that were asked in the session. I was reading the chat here. So one question was asked that as an expatriate, is a specialist in KSA, can he be, I think, promoted to become a consultant? Like there are two things. One thing is that my classification, like in Pakistan, what we would say in PMDC, yes, in the classification, I can be promoted to a higher rank. I can be a consultant just by giving an exam right now. That 5 years have passed, I can give an exam and become a consultant in only having a license. But in actual, at a job, there is no like time scale that a specialist would become a consultant. He would be hired as a consultant in that hospital from the day first. Very few hospitals have got this programs that they give the for the specialist a specific fellowship or a period of time of binding, and then they convert based upon his license, they convert the designation to associate consultant, then to consultant. But this is very rare in these hospitals. Only a direct hiring is. Mostly the consultants that are hired are either local trained Saudi nationals, or they are Western trained or European or American trained. As Dr. Zishan has just said, have got an American fellowship or a British fellowship. Now, another question that was asked, that are electives accommodated at King Faisal Specialist Hospital? I would be honest with you, I tried for an electives of a Saudi student who is studying in a university of UK, but the hospital policy did not allow it. I reached to my head of department, he reached to the head of department of academics, but they did not allow it. The reason is that here they have their own, first of all, university, and then there is a collaboration between the government universities only. They will first accommodate their own government university students, and then their private students of Saudi Arabia, Saudi students of Saudi Arabia. After that, they would prefer the Saudi students studying abroad. So, in such a long queue, many students, even Saudi students, miss getting the electives in the King Faisal or other specialist hospitals over here.
Okay.
AKU and MRI, this was good for me. One thing that what are the most common things that you hear about neurosurgery? Mortality rate is very high. I initially had explained it that this is sort of a myth. Like, if there is a good selection of patient, okay, with a good surgeon, the facilities are up to the mark. The mortality is like, in many cases, very negligible. Like, I know centers over here with surgeons having, I think, zero mortality. For the last 5 years, I haven't seen any mortality with. Okay. Okay, some degree of morbidity exists. Yes, it does, because it is a highly sensitive area. There can be some certain, like when we are working in the brainstem, or when we are working in the skull base, there can be a slight nerve weaknesses of the cranial nerves, palsies can occur, or even it could cause hemiparesis or plegia. But the thing is that the mortality, if in safe hands, a good selection of patient, mortality can be negligible with proper facilities. Post-operative care is very much important in neurosurgery. I've seen orthopedic surgeries happen in very remote areas, and where the surgeon operates and leaves the patient for a week and comes back the next week and discharges the patient. Okay, because they are dealing with either a femur or a tibia or a humerus. But the thing is, if they have done a surgery good, the post-operative care is just change of dressing, nothing more. But in neurosurgery, it is very sensitive. Like, you have to monitor the blood pressure, you have to monitor the, in certain cases, ICP, you have to have neuro monitoring, that is the pupils, the GC, Glasgow Coma Scale of the patient. So if the monitoring is not up to the mark, no matter how good the surgery is done, I've seen catastrophes happen. So this is yes, again, same question of Isha regarding the internships. No, Saudi Arabia does not accommodate internships or house job. Even the residents in the residency program, they have got this thing. They say that they provide residency across the board to anyone. But the thing is that when I checked in the Saudi Commission for Health Specialties, which was the accrediting body for the residency, just like our CPSP, they said that every student, even Saudi or Pakistani, have to pay a fees of 6,000 real per month to the body in order to get the training. But for the Saudi students, they are getting a scholarship, which is like they take 6,000 from the government and pay it to the Saudi Commission for Health Specialties. That is, they're paying nothing from their pockets. But if we would apply, we would have to pay it from our pocket, which is quite, which is quite some amount. Uh, Job via King Faisal. King Faisal has a portal for careers. Okay, and second thing is there is a recruiter in Karachi, and any jobs that are coming online, he normally does advertise it. Uh, Secondly, for the jobs. I've tried to make a, a group on the WhatsApp on which we are posting it very regularly. The Dr. Akil, who is also attending this session, he does a great job for keeping a search for the jobs and then posts in that group. And also there are other doctors who are actively participating, and even I have added a few recruiters in that group in order to provide the jobs for the doctors who are searching for jobs in Pakistan. Same prospectus and cases for no, of course the prospect 3.5 years fellowship experience. Yeah, the same. Based on FCPS, they will just Dr. Bilal. They will take as an assistant consultant, no matter if we have done secondary fellowship or not. There was one question regarding how many years that the neurosurgery pathway takes. Normally in Pakistan, it takes 5 years training after 1 year of house job, so it makes 6 years in total. Then exam, you know that it is either it is after every 6 months. I had passed the exam in the second attempt, so it was 1 year extra. So I took almost 6 years in order to pass the neurosurgery. There was one more question. Yeah, regarding what are this routine procedures in neurosurgery? In neurosurgery, general neurosurgery, we deal with the brain and the spinal cord. For the brain, the most common procedure is the craniotomy, and for the spinal cord, the most common procedure is the laminectomy. Then this is basically the gateway from which you enter, and then there is a whole spectrum of cases ranging from just a burr aspiration in the brain to a massive skull-based tumor, and or clapping of a giant aneurysm, or it can be an AVM excision, epilepsy surgery such as a lobectomy. But these are high complexity cases that are not done everywhere. Everywhere there would be a craniotomy for a tumor excision, or for trauma or hematoma, trauma craniotomy for evacuation of the hematoma or evacuation of a contusion. Similarly, spinal normally we do a laminectomy in order to decompress, or we take the disc out, or we there can be spinal instrumentations just like fixation, artificial disc placements. There can also be spinal tumor removals. There can be spinal implants for pain or spasticity, which come under functional neurosurgery. Now, the thing is that how is the prognosis? Prognosis depends again. It's the same thing: post-operative care, complexity of the procedure, the selection of the candidate, the center where the surgery is being performed. Then comes what are the next question?
Okay, in the
Where
time you see another question, I will just take 1 more minute again to highlight. Categories of hospitals in Saudi Arabia. The number one category of hospital is King Faisal. I am very lucky, and I will say that King Faisal was my academic mother. Okay, I respect King Faisal like anything. So you will say that if someone is even going in front of the King Faisal door, he or she will learn a lot. So that was my prime time of my career. I enjoyed my life the maximum. Whatever I used to see in the books only, or heard in the books, like stories of what you say pariyon ki kahani, I used to see in King Faisal. So King Faisal is the number one hospital, but as Dr. Adil, we cannot never become consultant over there. Okay, so that's why I would also suggest Dr. Adil to leave King Faisal after having a very good memories and become consultant in whatever hospital you are eligible for. Number two hospital is National Guard. They are in the with the name of King Abdulaziz Medical City. Okay, so National Guards are also there in number of cities. King Faisal is also a number of cities. Jeddah, Medina, Riyadh, and National Guards are more than that. They are in in Al-Hassa, Damam also. Okay. Then come the number three category, Ministry of Defense Hospital. Like I am working in the headquarter of Ministry of Defense, that is Prince Sultan Military Medical City. These are number three categories. Number four category are university hospitals. They are independent university hospitals, which are under some university. Like one of example is King Saud University, and there are two or three university hospitals under it. One of them is special for dentistry and sort of, I think, head and neck surgery, and two of them are separate: King Abdul Aziz University Hospital and King Khalid University Hospital. Then MOH Autonomous Hospital. Like I was working before in one of the autonomous Ministry of Health hospital. That is, I was in King Saud Medical City. So there are across Saudi Arabia, there are university hospital. Sorry, a Ministry of Health autonomous hospital. Then comes the usual Ministry of Health hospitals. Now, some of them are in major city, majority of them are in periphery, and that the people who are working there, I say salute to them, because it's really, really difficult to work over there. Number one, it's really, really difficult to live with the family. There are not good opportunities of good schools, no direct flights, no direct access to embassies, so it's really difficult to live over there. But of course, if someone is like sacrificing to have life without family, that is exception. But I never ever advise anyone to go there in the prime time of their career, because they will not be able to learn much, because their domain mainly is to refer. They want to receive the patient and forward it. They are not doing much of the work. Of course, maybe I'm overdoing this statement, but this happens. Then the private hospital, there are two categories of private hospital. One are very good groups, which are even international groups. Like one of them is Salman Al Habib, which is not only in Saudi Arabia, in some other Gulf countries as well. But there are other than that, there are individual private hospitals which are there across Saudi Arabia, with a group of hospitals or single hospitals. Okay, so this is something which, with reference to category of hospital. Remember these first three, even Ministry of Defense. I am very, very, very lucky. I am very, very blessed that I have, because worked in King Faisal and National Guards as assistant consultant and staff physician respectively. That's why, and with I have some other Western qualification. That was the only reason maybe I was selected as Ministry of Defense. And of course, above all, is the blessing of Allah that I am lucky that I got the job. Otherwise, not everyone. Yes, in Ministry of Defense, maybe Dr. Adil know, there is a very good neurosurgeon. His name is Dr. Raza. There was another Dr. Mudassir
Yeah,
who
I know
left
him.
for UK. Dr.
Oh, mashallah.
Raza is also, but again, he worked there for a very long time as registrar or senior registrar. Only then he
I
was
know.
promoted. He worked as
And
senior registrar.
yes,
Yes.
I know,
So
and I know that Raza was very much supported by his head of department, and
yes, yes. But
I
otherwise, you
know
will
this.
never see, even in Ministry of Defense. After that, university hospitals, even that is not very open for all Pakistanis. The problem is that the specialities which are 24/7, like anesthesia, is one of them. ICU is one of them. They have much more. Like in one hospital, maybe they need only four or five neurosurgery consultant, but they need maybe 20 or 30 anesthesia consultant, because in big hospitals it's consultant based practice, so they need a lot of doctors for that specialty. That's the only reason we are here. That doesn't mean that they love us. It's not like that. It's only they require, the number of people that they require is so much that their doctors are not able to fulfill their requirement up till now. But other specialities in which they can work twice a week or thrice a week, and they can have academic time, these specialities are now booked for Saudis. It's very rare for a non-Saudi to become a consultant in those hospitals. That's why I discourage people in junior ranks. Like Dr. Adil will be promoted, inshallah. Why? And maybe he can get a job in a better hospital, because he has a background of work in King Faisal. And if you have worked in King Faisal, you go to anywhere and only tell, I worked in 4 years to King Faisal. Oh, you worked in King Faisal, the Khasusi, specialized hospital. They will not ask you anything, because they know the caliber of work which is being done. But it's not everyone's cup of tea to get a job over there. Believe me, it's a special luck. Of course, Allah can make way for you anywhere. He can do without kun fayakun, but practically it's very difficult. Okay, so sorry to interrupt. Any other further question? Yes, Dr. Adil, I will take this form and I will try to share it in the really just a second, please. So I'm really thankful to Dr. Adil for his time
तो
and any
एक
question
क्वेश्चन
which you.
एक
Yes,
क्वेश्चन
yes,
दरम्यान में रह गया, बहुत ही किसी ने एक अच्छा क्वेश्चन पूछा हुआ था।
yes.
आ,
What is that?
उस क्वेश्चन के वर्डिंग्स बहुत अच्छे थे, तो मैं रिपीट करना चाह रहा था कि बेसिकली देयर वाज अ क्वेश्चन रिगार्डिंग द pros and cons of being a female neurosurgeon. Actually, I would say that this thing would be better explained. It was asked by, I remember, Dr. Azka, I think. I cannot go to the message due to some reason. Now, the thing is that I think if some of the female neurosurgeons would, if you're really interested in becoming a neurosurgeon, of course, you should talk to a female
Dr.
neurosurgeon
Adil.
who is ahead of you
I
by
would,
5 years, by
yes,
10 years. I can give
You know
you.
Dr. Fauziya, Dr. Fauziya.
Yes, Lahore General Hospital.
Yes.
She
You know,
she really
I will say a word about Dr. Fauziya. She was standing with me in King Faisal and she was so pissed off. So she said, I did not become neurosurgeon just to throw saline from outside. Either because the surgeon was doing with the microscope and she was just throwing saline. So I remember her word, and this is a word for anyone who wants to progress. Now she is mashallah. Anyone who wants to contact her, I think she will be very happy to guide any female
yes,
doctor who wants to. She is a legend couple because her husband is cardiac surgeon. So both of them are atomic bomb, I would say. I say
yes,
salam to Dr. Fauzia and Dr. Rehan. Okay. Yes.
sure.
Yes, Dr. Adil. I think we have enough of time. It's about to have Isha prayer time here. So I'm really thankful to Dr. Adil. Her name, she is not here. She's from Pakistan. uh, she's in Pakistan. She's a neurosurgeon, and her name is Dr. Fauzi. Anyways, Dr. Adil, first of all, you have break the ice because I was not able to start these series of sessions. I had contacted a lot of people from various specialities, and actually, the purpose of our this group was because I was involved in teaching of anesthesia for a long time, and suddenly I came across like a session back in our medical college, and that triggered me an idea that I should take medical students on board, junior residents on board, junior doctors on board, and guide them through their career. Okay. So for medical student, remember one thing: if you want to be a good doctor, please study hard, study clinical based. Even if you are in basic sciences, you should try to study in a way that you correlate basic sciences to clinical science, because without it basics for the sake of basic is useless, because nobody will remember the things which are only basic. They have to top up with clinical sciences. So this is the message. Another message: our forum is not for any conflict of we don't have any conflict of interest. Our aim is just to facilitate our students. Yes, of course, mainly from Pakistan, but because I have recorded this session especially in English, because our door is open for anyone who wants any sort of guidance. We are there to help it out. Initially, my aim is to get all the specialities doctors on board, make us recorded sessions for all specialities, and then I will try to make a group of doctors from that specialty. Like because Dr. Adil has got the first session, so I will request if you can make a group of doctors who are ready to help out anyone who can reach out them with through WhatsApp or through messages. They you If any opportunities you can tell. And then again, I will request you that I have made a group, made a folder of all the books, articles, questions. You can say a bank of anesthesia knowledge. Okay, so similarly, I would request all of the other specialities to make a bank like that, where everyone can access. This is one thing. Then later on, our this make nipping birds blooming flower. Make nipping birds blooming flower. Our aim is to guide our juniors, our medical students to be a good doctor, not only passing the exam, because there are a lot of people who just say, please pass the exam, knowledge will come throughout the year. Please don't do like that. You are dealing with human beings. you are dealing with some dear ones of any individual. So you would never like your mother or your father to be dealt by a person who has no interest in knowledge, and he doesn't only he or she only wants to pass the exam. Please have mercy on yourself, because if you will do like that, believe me, your family member, god forbid, will be also be treated by someone who does not have any interest in knowledge, and they only want to pass the exam. So I strongly discourage the people who wants make the people in tunnel vision of only passing the exam. Like just like the great that movie, movies sometimes give you a big message. In the message which was there in Three Idiots of Indian movie, that the message was that you get the knowledge, exam will follow you, money will follow you, career will follow you. But if you want, just you just have a dream. I also had that dream. I was stuck in. Dr. Adil was very lucky to pass the FCPS exam in 1 year. I passed around in 3 years, almost 3 years. Okay, near to 3 years. And many times I used to sleep and I used to pray that when I wake up, I become FCPS. But it never happened. It never happened till the time I was able to satisfy the examiners. I had the knowledge. I had the communication skills. I did not pass. And also remember one thing: no examiner is your enemy. They want to pass you. Yes, they have a certain criteria you should have. So my request and my suggestion to all of you: join our hands. We don't have any, again I repeat again and again, we don't have any conflict of interest. Later on, I have an idea. Of course, I cannot do it alone. I need a lot of people to join me. That I want to make you can say bank, financial bank, where we can help and guide anyone who has the capability but does not have the financial resources to appear in exam. So we would like to sponsor them and help them with the commitment that they will return that money when they have passed the exam and they have reached the glory. Okay, so this is what I wanted to speak out, and I wanted to say. uh, Thanks a lot, all of you. Okay, so I have got the number of, I have given my number. Dr. Adil is nice enough to give his number. Please don't disturb him a lot. Neurosurgeons, while doing the surgery, if they will be pissed off by your messages, they can damage a brain. Anesthetists, yes, after an intubation, we run, we run from one place to other place like a monkey and like a donkey or like a frog. So for us, there is no problem. Yes, our
Nini,
mind
don't
is
worry.
working. Okay.
Nini,
So
don't worry that when I operate, you have experienced it today. Actually, when I operate, my all phones are on aeroplane mode. I'm
yes,
flying.
yes, I
So
can
I'm
understand.
flying.
Anyways,
Yeah.
anyways,
So my
that's the
phone,
difference.
phone was on aeroplane mode, so I could not get any of your messages. So I replied as soon as I
That
re-stepped in
I
between
can
you and after.
I can oath on your words. Okay, Dr. Adil,
Yeah.
again, special thanks to you. Special thanks to all of you who joined us.
Thank
And please
you.
stay tuned. We will be coming with other specialities soon. Okay. Any question,
Okay.
anything you
Okay. Thank
want to ask, please feel free to drop a message to me. Any question related to neurosurgery, please. And Dr. Adil also has some interest in research. So I'm just blank in research, but Dr. Adil also has some inclination towards research. So I hope that he can guide us for that thing as well. Thanks a lot, everyone. Stay tuned, stay in touch, and please request my request: the day of your life when you wake up in the morning and sleep without learning something new, or without teaching something you know to others who doesn't know, that day of life you lost. I will repeat and I will finish. The day of your life when you wake up in the morning and you sleep without learning or without teaching, that day of life you lost. So my suggestion to you: help others, because it will come back to you. Learn the knowledge for the sake of knowledge. Don't learn the knowledge to become a billionaire. When you have the knowledge, believe me, the respect and money will follow you. This is guarantee, inshallah. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Right. So.